With that, I'm going to turn it over to Barb Jakubik, who is the Director of Berks County Children and Youth Services. Barb?
Just a moment.
And we will unmute you here in a second.
Barb, you should be able to unmute yourself. There you go.
There we go.
Can you
Good.
hear me?
Yes.
Great. Good morning, everyone. Thank you for joining us. My name is Barb Jakubik. I'm the administrator at Berks County Children and Youth. I've been with the agency for 34 years, have only been in this role for about 10 months. And I appreciate everyone coming to this chat to learn a little bit more about the work that we do. I would like to acknowledge Cindy Millian, who works with the Community Foundation. She is also a former intake worker and screening supervisor from Berks County Children and Youth, and currently serves on our advisory board. And she is the link, the connection that helped bring us to the community forum today. So thank you, Cindy. You're going to hear from 5 individuals today. I'm one of them. This is our entire administrative management team. We have a deputy. All of the county departments now have a position where they have a deputy administrator, somebody to fill in when the administrator is out. Our deputy is Jennifer O'Neill. She certainly does so much more than that. She oversees the 3 managers that handle the various departments within our work. Our managers are Olivia Torres. She is our intake manager. Kelsey Glass is our in-home services manager, and Carla Sanders is our permanency manager. She's on a vacation day, so she's coming in remote. Hopefully we don't have any glitches with her. As Dave mentioned, we do have a mission statement, and it is to protect children and assure their physical and emotional well-being as provided by law, and to preserve, strengthen, and empower their families. I really want to highlight those last couple of words: preserve, strengthen, and empower their families. Oftentimes people think that the role of a child welfare worker is to intervene in such a way that separates children from their families, and actually the opposite is true. Whenever possible, our goal is to keep children in their own homes and to provide the support and services if they are necessary. And we'll talk a little bit more about the work that's being done at our intake level to determine, if there's merit to an allegation of child abuse or neglect. We're a big organization and a somewhat complicated organization. We are operated at a county level. I report to the COO and the deputy COO here in the county, and they report to the commissioners. But we are supervised by the Office of Children, Youth, and Families at a state level. They handle our licensing and inspection every year. They request once a year that we complete a needs-based plan and budget in order to tell them what our fiscal needs are for the coming year. And then we project out for a year beyond that as well. So even hierarchically, we're a little bit complex in terms of understanding. We also have an advisory board that we meet with 10 times a year. One of those meetings is very specific to our yearly needs-based plan and budget request. That meeting is always held in July. It is open to the public, and we talk about what's happening in the agency and what kinds of new and different regulations there might be or requirements for us. And then on the back end, we're looking at how much is it going to cost us? What do we need to do here within the agency, to make sure that we're compliant with all of the federal and state laws that govern our work. Our projected budget for this fiscal year is $55 million, a little more than $55 million. And our funding stream is very complicated. We receive federal funds for children who are in out-of-home care. We receive money from the state of Pennsylvania. And then the county also has a certain match, depending on what the service is, that they contribute to the cost of the services that are provided. In addition to those funding streams, we also receive grants. Most of them are from the state of Pennsylvania, and they're very specific. So we receive money for our older youth who are in out-of-home care to learn independent living skills in order to be able to function on their own when they leave foster care. We also have other grants, very small grants to help families with housing or parenting skill services. One of the things we're really starting to look at is the ability to draw down some federal funds for evidence-based programming. So that is sort of a new initiative that's happening across the country, is the ability to bring in some federal funds for that. Then there's also some of our, the cost of children in out-of-home care under the probation department falls under the child welfare budget. Not all of their costs, but there are some. So we are tied, we're linked into the juvenile probation office as well. We're always asked to talk about what's going well and where are our areas of concern. And one of the things that we're struggling with, as are many child welfare agencies across the Commonwealth, is the turnover in direct service work. It's very challenging receiving reports of child abuse and neglect and going out into homes and talking with parents about what happened. Sometimes we're not welcomed into the home, and families are upset because a report has been called in. And so it can be hard. One of the things that we've done as a result is we've been working with our private provider community to help us out in certain areas. So, for example, there are a number of private foster care providers in the community. You may have heard of agencies like Concern and Children's Home of Reading, Kids Peace, Diacon. We're partnering with some of those agencies to help us in terms of licensing foster homes. We also, a couple of years ago, had started completing what's called family group decision-making conferences for children and families, bringing families and their identified supports together to help the family develop a plan. And it's always so much better when a family can put together their own plan for the safety of their children rather than having someone else, the agency or the court, tell them what to do. We had a unit here in our agency dedicated to doing that work, and we're now working with some other agencies to support us in that way. And then family finding. One of the things that we do when a child enters out-of-home care is we look for birth family, extended family, to help care for the child that's in out-of-home care. And so we're getting some additional support from our provider community as well in terms of our family finding work. One of our other challenges are complex cases. We're seeing a lot of children coming into out-of-home care that have significant behavioral health concerns. And we're also seeing an uptick in the number of children diagnosed with autism, where we are not able to find placement providers that are willing or able to care for them. So that's another area of the work that we're looking at and trying to refine some of our processes. And then transportation, there's a big need for transportation, helping kids and families get to appointments and visitation and things of that nature. On the flip side of that coin is we are recognizing that we are having some success. Right now, we have a fully staffed administrative team, including myself, the deputy, and the 3 program managers. We are engaging with all of our local colleges and universities, and even some further away from Berks County, to bring in interns and bring in new employees. I'm happy to say that this semester we have 8 interns currently working with our agencies, and a shout out to all of the supervisors who are helping to get them ready for their next chapter in their life, as well as, working with the schools and developing plans for their learning processes. So just to give an overview of the workload, I used some data that we collect starting with October 1st of the last 5 years. And just to show you the increase in the workload. So as Dave mentioned, COVID was a very interesting time for us. Our workload went way down, and that was predominantly because schools were closed, and schools are our #1 referral source. And so in October of 2021, there were 815 children known to our agency. That was at all 3 departments, at intake, in-home, and permanency. And then you can see there was an uptick in 2022. We went over 970 cases, came down a little bit in 23. In 2024, October 1st of 2024, there were 1,200 children that were known to our agency in any of the 3 departments. And this October, we had 1,645 children that were active with our agency. So we doubled in the last 5 years the number of children that we were serving here at Children and Youth. So looking back holistically over the last year, we're not done with 2025 yet. So just looking at 2024, all of the reports that we received in the agency, there were just shy of 10,000 incidents that were reported to our agency. We accepted a little more than 1/3 of them for investigation. Not every report that comes in warrants an investigation. And we have 2 screening units that look at every report. They work with their supervisor to determine if this is a case that we should be investigating or if it can be handled in another way. We also have an emergency duty and second shift. We are an organization that, even though our office closes, we have somebody available on call nights, weekends, and holidays to accept reports of child abuse or neglect. And those individuals received 737 reports during their time. So starting at 3 o'clock, we have second shifts that come in and they handle reports from 3 to midnight. And then our emergency duty workers are nights, weekends, and holidays. So right now, this is our workload. We have 1,600 children open on some level of the agency. A little bit less than 250 of those children reside in out-of-home care. That includes children in foster homes, group homes, and residential facilities. We have another 121 children that are dependent and reside in their own home. And Kelsey will talk a little bit more about that later, but an adjudication of dependency means that the child is before the court, the juvenile court, and they are assigned a guardian ad litem, the parents are assigned counsel, and there's more oversight on those cases and families. And the court can actually order parents to participate in services and follow through. And then we'll check in on those cases at least once every 6 months, sometimes more frequently. So that means of the 248 children who are in out-of-home care and the 121 children that are dependent and reside in their home, about 22% of the total volume of our workload are children who are known to the juvenile court. So that's a good amount. That's 78% of the work that we do that is not before the court. And again, just going back to our mission statement, we want to make sure that people know and understand our goal is to keep children with their families whenever it is safely possible to do that. Okay, and I just wanted to give a little mention to a program that we have here at Berks County Children and Youth. Years ago, we started a program called Partners in Parenting, and it was foster parents who were helping birth parents learn the skills and services necessary in order for them to care for their children. That program has really grown and expanded. Those individuals now help supervise visits. They watch children in our playrooms when children come in for court. They don't always stay in the courtroom the whole time. We have some playrooms that they can go to. They provide supervision during family group decision-making conferences. They do a number of things. And a few years ago, they started talking about how difficult it is to teach parenting skills in the services center, in a room in the services center. And could we get a house where we would have a more natural environment for parents to learn the skills that they need? It's really hard to teach a parent how to give a bath to a young child here in the services center. So we were fortunate enough to be able to use a grant, a special grant that we have, to lease a home that we use for that very purpose. We teach parenting skills there. We have visitation between children who are in foster care and their parents. It's got it's got 4 visitation rooms on the first floor, and then the second floor is an apartment that has really been wonderful when we have a large family, 6 or more children in the family. There's a kitchen and a dining room where people can prepare a meal. We have a variety of things that we can, we have gifts that parents can pick out a gift, and we'll have wrapping paper that they can wrap a gift, and cake mixes. They can bake a cake and have a little birthday party for the child. It's a much better and more natural environment than it is here in the courthouse. I mean, we have some really cool, wonderful playrooms. We now have a sensory playroom for children on the autism spectrum to be able to enjoy. But you can see there's a backyard. We have a little bucket garden. Kids can water the plants in the bucket garden. We have bubbles and sidewalk chalk. It's just a happier, more natural and healthy environment in which families can come together. And of course, we do have a little room for our teenagers that has a Wii and, some fun games like that for them. But it's a really wonderful program, and we are so fortunate to have virtually everything in the house is provided through donations. And they do have a Facebook page if anybody's interested in following them and learning a little bit more about the Lifehouse. So what we're going to do now is we're going to go through the 3 primary departments. We have an intake department. They're our front door. We have an in-home department. They service kids and families in their own home. And we have a permanency department. So you're going to hear from each of the managers in those departments, and then we'll end with Jennifer O'Neill, who's our deputy, and she's going to talk specifically about some of our recruitment strategies in order to help us with our staffing. So I'm going to hand it over to Olivia Torres, our intake manager.
Good afternoon, everyone. My name is Olivia Torres. I'm the intake manager here at Children and Youth Services. Like Barb mentioned, the intake department really is the front door of our agency. I was with the intake department for a number of years as an investigator and then as a supervisor. Took a brief hiatus for a bit from the agency and returned about 5 months ago to my current role as the manager here. So within the intake department, really, we have caseworkers that are the first responders to reports of suspected child abuse or neglect. As we move along, I'm going to talk about kind of the breakdown of how those reports are received by our agency and how they navigate their way through the intake department itself. But right here is just kind of a brief overview of the kind of reports that are received by county child welfare agencies. So the first one is a Child Protective Services report, or we would refer to that as a CPS. And the second kind is a GPS report, or a General Protective Services report. A Child Protective Services report is really something that is received through our child line, which is the state hotline for the community or the public to call in with concerns of potential child abuse or neglect. That CPS report is numbered in line with the Child Protective Services law, which is through Pennsylvania. And that CPS has to have those allegations meet the criteria of child abuse as defined by Pennsylvania. A General Protective Services report is really, to make it simple, it's a concern for the general well-being of children. Some of those concerns could be homelessness, it could be mental health concerns, it could be substance use concerns, truancy. There's really a large umbrella for those reports to meet the criteria of a GPS. As Barb mentioned earlier, our department does function 24 hours a day, 7 days a week. We have first shift workers, second shift workers, and then our emergency duty workers as well. When our caseworkers receive a report of suspected child abuse or neglect, our investigation can last up to 60 days. So our workers are receiving those reports from the screening department, which Barb mentioned earlier as well. And they're going out to the community. They're finding all parties that are pertinent to their investigation, whether it be the children, parents, caregivers, teachers, anyone that's associated with the report itself. And we're interviewing all parties in different settings, whether it be through school systems, their homes, hospital systems, jails. And then during our 60-day investigation period, we're really working to determine if there is a need or a concern for our agency to continue to support the family. If we identify any areas of a concern, whether it be drug and alcohol use or mental health concerns or concerns for housing or lack of stability, we would put in the home what we call a service provider, which is a contracted agency that we have go out to the home to do more hands-on case management services with the family. During our investigation period, if we find a need for the family to continue to receive those services, then we'll pass the case from our intake department to our in-home department, which Kelsey will touch base with later on here. If for some reason, unfortunately, we respond to situations where children are deemed unsafe, then we would seek a judge's order to be able to remove the children from the home. If that is the case, then we would pass the case from our department to Carla's department, which she'll talk about later as well, which is the permanency department. At the end of our 60-day investigation period, we complete what's called an outcome. An outcome for our investigation is really a determination of if the agency found substantial evidence to support what was reported, whether it be through our CPS reports or our GPS reports. Barb, if you can go to the next slide for me. So this kind of gives you a brief overview of the volume that our agency experiences over the years. As you can see, from 2020 to 2021, there was a little bit of a drop in reports. Some could, make the connection that that was due to COVID. But as you move along, really, there is a similarity into the number of total of calls our agency is receiving. It usually hovers about 10,000 calls a year. The number of reports that we accept for investigation usually hovers around 3,000 each year as well. And really, those total calls that are coming in, some of them don't meet the criteria for our agency to get involved to investigate. Some of those reports our screening department works diligently to be able to make community referrals so that our agency doesn't need to be involved. And some of them just warrant law enforcement rather than children and youth investigation as well. Next slide, please. So this is really a breakdown of kind of how the investigative process works and how our agency receives our reports. So at the top, you can see it's referrals to children and youth agencies themselves. So there's various ways those reports can come in. Our screening department can receive them through Childline, like I mentioned earlier. They can also take walk-ins from the community, or the community may call in with concerns, and our screening department can write those reports up as well. Like I previously mentioned, the screening department will then work to see if they can make community referrals for the family or alleviate concerns in another way to be able to prevent them from entering the investigative portion of the intake department. If not, then it will get passed over to our intake workers. Our intake department also has a specialized sexual abuse unit within it as well. So any reports that are pertaining to that topic filter to that unit within the intake department. Next slide, please. This graphic here is showing the different categories that are associated with that CPS or Child Protective Services report I mentioned the first time around. These are some of the different categories in which child abuse can be classified in Pennsylvania. Some of them such as causing bodily injury to a child or creating the reasonable likelihood of bodily injury to a child. If you refer down to the bottom left-hand corner, that's talking about the outcome decisions for a Child Protective Services report. So if anyone has applied for clearances, like a child line clearance, these are really those outcomes that you will see. So with a CPS report, if a report is unfounded, that means our investigation was completed and we didn't feel as though, or we weren't able to substantiate that the alleged abuse occurred. If a report is indicated, the agency feels as though we did have enough evidence to support what was reported. And then the reports can even get taken to the level of being founded. When we receive a Child Protective Services report, usually the county detectives or some sort of law enforcement officer is also simultaneously investigating those reports from a criminal aspect. So for a report from our end to get founded would mean that essentially there was some sort of charges that were pursued and followed through on the criminal end of this as well. So we work really hand in hand with the detectives and different police departments as well to complete a diligent investigation. One of the things that really stands out on this graphic as well is that you can note that a total of 1,187 CPS reports were received from our agency in fiscal year 24-25. Out of those reports, about 14% of them were substantiated, and we were able to say that yes, there was enough evidence to support that this alleged abuse or neglect had occurred. So that is quite a bit of investigations from our department itself, with a 14% rate of those being substantiated. Next slide, please. Just like any part of the agency, intake also is going through various challenges as time goes on. Our intake department is very lucky in the fact that it is close to full capacity currently, which is a fantastic thing. There's a lot of workers to be able to keep up with the volume of work. However, on the flip hand of that, a lot of these workers are new staff members. So the reports that are coming in the door that we are responding to, they're very complex social situations. It takes a lot of skill and experience to be able to respond to these situations that we are responding to. We are going out there and dealing with critical, family situations that are usually the family is in crisis, and we need to have those skills to be able to de-escalate the family and identify the areas of concern, while we continue to make sure that we are following through with our duty to assure the child's safety, but also, empowering the family to be able to get their things together themselves and identify their own concerns and move forward in the right direction. Due to some staffing challenges over time, the agency has had to take some of our GPS reports and overflow them to different departments of the agency to try to keep up with the high volume that is coming in through the door. At this time, we've been able to alleviate that, but it really is an all hands on deck process here to support the intake department and the agency as a whole to make sure we are completing the work we need to. Over time, we're really making sure that we're strengthening our community connections. Just like any agency, we benefit from being able to collaborate with community resources and community partnerships to make sure that we're best serving families that we are meeting with and working with along the way. We also have a CWEL program, which is Child Welfare Education for Leadership. That is for individuals to go to school and receive their master's in social work degree. We are very supportive of staff taking that process. Of course, we would always want to support our staff furthering their education, but it's also benefiting our community and our families that we're serving every day, because we are getting great, adequate workers out of it. And, just they're broadening their mindset to be able to really meet families where they're at, which is a great aspect of our agency to be able to carry forward and serve them in an appropriate manner. So that is a very brief overview of the intake department currently. Like I said earlier, in our investigation period, if we identify concerns or an area of need for a family to continue to be serviced, then we will pass those cases and those families to the in-home department, which I believe Kelsey is up next.
Hi, everyone. I'm Kelsey Glass. I'm the in-home services manager. I have personally worked in both the intake and the in-home departments as caseworkers. And so now I am managing in-home. When you think of the in-home services department, like Olivia said, it is a lot of the families that need more support and more assistance to remediate the concerns that brought them to our attention. We also have many different things within in-home. We are kind of like the kitchen sink. We do a little bit of everything. So while we have cases that are open and we're monitoring and we're providing services, we can also receive reports, new reports of child abuse or neglect on those families that we may need to go out and we may need to investigate and service within that other type of service and in-home department work. So we do that. We also at times have to follow judges' orders, removing children when there is some sort of imminent danger or risk to a child. So we are involved in that as well. But as you'll see as we continue, in-home does many more things than just servicing a family for ongoing services. But like our mission statement said, the whole point of the in-home department is to really try to preserve the family. That may mean a child is residing with a family friend or a parent or a relative, a caregiver. We service a lot of different families, and that makeup of that family system can look different depending on the client that we have. And our goal is to really try to provide them with what they need and maintain the children in their current home, if at all possible, and then continue to make them independent of the agency so that if another scenario would occur or they need some sort of resource, they can look and they can find it on their own without agency involvement. Next slide, please. Thank you. So in the in-home services department, you can see the last couple years we have had an uptick in our active families and the number of children. However, the number of children that are dependent upon the courts has relatively remained the same. In the in-home department, when a family is not progressing, maybe a family is uncooperative, there are new safety concerns or imminent risks, we may need to take that family to the court to determine, does that family need court oversight and supervision? And when that happens and the court agrees that a family does need supervision, they will make that child dependent. So the number of children that we have currently, Barb had said was 101 as of June 30th. It was, Barb said it was 121 as of June 30th. It was 101. So you can see in the last couple months, we've added a few children to that number. However, it is still a very small percentage of the work we do that has court oversight. It's about 14%. And in the last several years, that number has continued to go down, even though the active families and the amount of children that we are servicing is going up. So that is a testament to our caseworkers and the work that they do on the in-home level to really try to keep families together and make them independent of our agency. Next slide, please. So these are some of the services that we offer to our families. There are many, many, many more services than this, but I just wanted to give you a little taste of what we do. We do have family preservation services currently through one of our providers, Diacon, and they are working with the family and trying to remediate any concerns within the home, very similar to, a home-based therapeutic intervention. So we do offer that in several different forms. This is one of the newer programs that we've had great success with. but we do have many other providers that do something very similar. We have several provider agencies that do parenting education. That parenting education can look different depending on the needs of the family. Sometimes a family with a small baby might need really a curriculum of they don't know how to make a bottle, or they don't know how to administer medication, or, in 5 years, they don't really know what the milestones their child is going to be hitting, and they need to get more information about that. We have parenting education that's hands-on, of getting up with the family and teaching them, okay, when this happens, we need to do this, or teaching them discipline techniques that are safe and appropriate. And we continue all up to the teenage years. We have parenting education that is tailored to teenagers and trying to set limits and boundaries and what occurs when those limits and boundaries are broken. So our providers do a wide variety of parenting education. We also have substance abuse treatment. We have domestic violence treatment that we assist in providing to our families, mental health treatment for children and adults. A lot of times our families need that referral, or they have a struggle where they don't know where to go with those services. They don't know how to access those services. And so we try to continue setting them up with those services, referring them for those services. While we are doing all of this kind of background work, we are also seeing the children every 30 days in the in-home department and their families to continue to monitor their safety. So it is an ongoing process every month of assessing the family and assessing the children in their own home. That may mean that if there's 5 children, they may live in different places even though they're siblings, and we need to go out and we need to assess each child within that placement. Or it might be a caregiver. So we're still going out and assessing those children. The other services that we offer, we
You
do.
stop for one quick second.
Sorry.
Barb, can you put the PowerPoint back up again? It's no longer showing. Go ahead, Kelsey.
We also offer family group decision-making conferences like Barb had said in the beginning, and family finding. Family finding is voluntary when you are not court involved. When the courts are involved, it is typically mandatory that we look for extra family supports to assist and kind of help to remediate those concerns. We have dedicated caseworkers that complete that at the moment, and we are based on staffing issues, looking at other providers as well to assist us. And they reach out to family members, inquiring, how can you assist the family? They reach out to the family members that are already involved, trying to get, their ideas of what can we do to assist the family, and can you be a support to this child? Family group decision-making, that is a program, like Barb said, we did have it in-house. We had to kind of outsource that with our staffing challenges. But that is where we refer the family. It could be most any issue, parenting concerns, drug and alcohol concerns, safety concerns, and just really trying to get the family's supports. So that could be friends, that could be relatives, that could be someone from their community, from their church, to see how can they support them and make a plan of how do we remediate this concern, or how do we not allow this concern to happen again. And so that's done, and that is based fully on the family support, and the family is the one to come up with that plan, and we are just facilitating that plan to happen. Sorry, I have the PowerPoint pulled up, so I'll give you some information about family group decision-making and the stats that we've had. Our family group decision-making conference started in January of 2008. So we have had that offered to our families for a number of years. The last in-house BCCYS conference was held in March of this year, before we outsourced our family group decision-making conferences. So far this year, we've had 17 referrals for that. We've had 8 completed conferences, and we had 5 that are still in the works. I believe there was 3 or so where the family was unable to make a conference happen. And sometimes that can be because there's not enough supports. It could be because the family has changed their mind. So that's kind of a little bit about our family group decision-making conferences.
Thank you, Barb.
Next slide, please. I think if you click on it, Barb, on 20. Well, there we go. So like I kind of said, in-home is kind of like the kitchen sink of the agency. We do a lot of different things, and it's not just assisting with direct casework. Within the in-home department, there's also the managed care and quality assurance unit. And they are assisting the agency within the agency and with our provider community and our placement community to ensure that our clients and the agency are receiving the services that are being paid for. Our managed care caseworkers, they support our regular direct caseworkers with children that are in foster care. It sometimes means coordinating meetings between mental health providers, schools, CCBH, and the families to ensure that the children are receiving medical care, mental health care, doctor care, anything that you can think of. They're kind of helping to facilitate those meetings. And they are also coordinating the medical benefits for children that are in out-of-home care. Like Barb said, we've had complex case, a lot of complex case referrals come into the agency, and our managed care unit also assists with that. And they continue to coordinate those meetings and trying to find placements for children that can be much more difficult to place, generally based on mental health behaviors or aggressive behaviors or some sort of, physical or mental disability. Quality assurance. This is really our looking in and looking out of the agency. We are, through our quality assurance unit, we are looking at our policies and procedures. So we are revamping our policy and procedure manual along with all of our old policies that we have in place. So that's something that we have been doing the last several months. We also are looking at any new bulletins that come in from OCYF and how we can submit to them and create a plan of how we can go about ensuring that we are following the regulations. Along with quality assurance, they continue to assist us with our orientation of new hires and interns. They do a lot of trainings for our agency in regards to getting our new hires and training interns trained and setting them up to be successful. We do have a statewide case management system that is coming. It's going to be rolled out in phases, and that's something that our quality assurance unit will also be looking at to see how can we assist the state in creating this and making it better and easy to use for all caseworkers. As well as that, we have our quality assurance caseworkers looking at our providers, going over contracts, making sure that our providers are providing the services that we would like them to and that we're paying for, and ensuring that we can provide the correct services to our clients. So like I said, they do a lot, and in-home does a whole lot of different things for the agency. Next slide, please. As with every department, we have had our strengths and challenges. Some of them are similar to the strengths and challenges that Olivia has stated. Our in-home department was assisting the intake department with cases, with investigations, so that created some higher caseloads. We've had a lot of complex cases where it takes a while to find placements of children, and so they can be open on the in-home level to continue to ensure their safety and work on finding them a more permanent placement. Staffing shortages, obviously the entire agency has had a struggle with that. but we've also struggled with out-of-county cases. We have a lot of transient clients that kind of shuffle from one county to another. So we've struggled in kind of pinning down some clients and really trying to service them based on their constant move. Truancy has also been a challenge for us that becomes more and more difficult to find services for children that are truant or continuing to service older youth who are failing to attend school. The strengths, we have a lot of interns, like Olivia stated. In the in-home department, we have a lot of tenured staff, caseworkers and supervisors included. And we have several interns upstairs and that have then become employees. And we also currently have several Seawell students, like Olivia stated, that's dispersed among the agency. So we're happy to have some of them in-home as well. And I think that is it for me. I'll turn it over to Carla.
Trying to find Carla. Carla, what name are, oh, there you go. You can unmute now.
Okay, thank you. Good afternoon. My name is Carla Sanders. I'm the Permanency Services Manager here at the agency. I oversee the department that once children are placed in out-of-home care. My unit takes those cases and primarily works to try to reunify the families together. If you want to go to the next slide. As of July 1st of 2025, we had 257 kids in out-of-home care, and this is just kind of a breakdown of where they were placed. The 219 kids that were residing in foster homes, that is actually both traditional foster care and kinship care. Whenever a child comes into out-of-home care, the first thing that we will attempt to do is to try to find a family member that is able to take care of that child. We will do some searches to try to find family members, whether they're in our community or outside of our community in Pennsylvania, but also in any other state in Pennsylvania or in the country. And we will try to work with that family to see if they would be in a position to take care of the children while they can't be with their family. And if that can occur, we try to move the kids to that setting as soon as we can. And then the breakdown of the other kids is that in July 1st, there was 23 kids living in group homes, 11 were in institutions. Those are often the residential treatment facilities. And then 3 kids were in independent living situations where they were really focusing on learning those skills so that when they were leaving care that they were ready to leave and live independently. If you want to go to the next slide, there is just a breakdown of the ages and ethnic groups that we work with, or that the kids that were in care at that time. And then if you want to go to the next slide, whenever a child is placed, Barb, do you want to go to the next slide? Thank you. Whenever, I think you went backwards.
You went backwards.
Whenever a child is placed into out-of-home care, our goal is always to try to reunify the family whenever possible. So when a kid is originally placed, the goal 99% of the time will give the primary goal of adoption. So as of the July 1st date, 172 of those kids that were in care had that primary goal of reunification. We will, in a sense, offer the same services that the in-home department will offer to the families. But sometimes with that additional court oversight, or when a family can just focus on their needs, there's time, a lot of times they can be kind of more successful when they are able to just focus on themselves and not also raising the children at the same time. So we are able to successfully get the children back into the families in the time frame that we're allowed. If you want to go to the next slide, Barb. The Adoption and Safe Families Act, which is a federal act, says that if kids are in care for 15 out of 22 months, that the agency has to file petitions to terminate parental rights. It really does give the families, the parents, a time frame that they have to focus on addressing whatever issue brought the child into care to be able to be in the process of successfully rectifying that problem for the child to go home. there is a clause in that the court has the ability to issue compelling reasons to say that we do not have to file those petitions. That is normally done if we are actively in the process of being able to reunify children. We never want to reunify children in too early that they're going to end up being unsuccessful and having to come back into care. So in those situations, we would advocate for the court to give the family a little bit more time so that we can make the reunification successful. And then we also have situations that unfortunately, we're not looking at the kids being able to go home in that amount of time. So in that situation, we would be looking at the court to change the goal and look at other goals for the children. The second most permanency goal for children is adoption. That is the process of terminating parental rights and the child being adopted. As of July 1st, we had 66 kids in that category that were in that process. If you want to go to the next slide, Barb. A lot of times older kids, especially kids who are 14 and older, would have to consent to their own adoption. And there's a variety of reasons that some kids aren't interested in doing that. Especially the older kids, we might be looking at more emancipation for them when they turn 18 and want to leave care themselves, or guardianship, which could be with another family member, or potentially even with their foster family if they have a good relationship, but they're not interested in having their parental rights terminated and being adopted. We can look at having them stay with that foster parent long term without the agency involvement. As of July 1st, we had one child who was working towards that emancipation. We had 18 kids that were looking towards that guardianship situation. One of the challenges that we face in our department is working with those kids that are 14 to 21 years old, and really being able to prepare them for independence when they leave the agency, the custody of the agency. We can keep kids in care after the age of 18 if they are meeting certain criteria. They either have to be in school or actively working or looking for a job, or there are some kids that are unable to work, so they are also able to stay in care. In that group, they can leave our custody if they want to be a little bit more independent, but also still have the support of the court and the agency. They can actually go on room and board stipends where they are still dependent children. They are living sometimes on their own, sometimes with somebody else that they know. And they are still meeting with their caseworker on a monthly basis. They're still meeting with the court every 6 months. But they are kind of doing it on their own, just with that extra support there if they need. So we currently have 7 kids in that situation that are kind of being very successful on their own. And some of them are in college, some of them are working full-time and kind of getting to know life as independent adults. Of the children that we had in care as of July 1st, 62 of them fell in that range of 14 to 21 years old. We have really been kind of looking at what we can do to kind of make sure that those kids are ready to leave care and have some skills that they need to be independent in life. So we have recently switched to a new program for those kids called Life Skills Reimagined. It's an evidence-based online program where we can have them do it's a computer-based program that is at their pace. So they can go on whenever they have time and do a section and then kind of wait and do another section at another time. But it gives them a pre-test and then has an education part of it, and then also gives them a post-test. It helps them to identify the topics that they might need more information on and develop a plan for what we can do to help them obtain that information, so that when they leave care that they have those basic skills of knowing about finances, knowing about how to rent or buy a house or a car. And there's 9 topics altogether that we give them information about. So that is kind of one of the newest areas for these kids that we're kind of really focusing on to try to help them be ready when they leave care. Barb, if you want to go to the next slide. The other area Barb talked a little bit about is our complex kid cases. unfortunately, we are having quite a few kids coming into care that just have a lot of issues, both behavioral and emotional issues. And they're challenging. They're challenging not only for their parents, but they're challenging just in the sense of being able to find foster parents or group homes that are able to care for them and meet their needs. You can see over the years that our numbers of those complex cases have actually come down. And that's really only because these are the numbers of kids that have truly been complex cases in the definition of the state, in that we've had to pull together a team of state people to help us locate placements for these kids. There is a process that we go through to pull together a number of people, both locally and at the state level, when we are struggling to find an appropriate placement for these kids. That we will meet on a weekly basis and kind of have all hands on deck to try to help figure out where the child can go that is able to meet their needs. We have definitely gotten better in the years just because of the agencies and the connections that we've made really across the state, in knowing what agencies can handle what behaviors of children. So although the numbers look like they're going down, we actually have quite a few kids that we don't have to bring to these complex cases just because we're able to find the placement with the connections that we've made with agencies. There is an agency out in the western part of PA that has done wonderful work with some of these kids, and we actually currently have 5 kids placed out in that agency right now. So some of those kids some of them were complex cases, but some of the additional ones would have been if it wasn't for this agency being able to kind of take them on and work with us for them. Same thing with the other departments. I mean, we have the challenges of staffing at times. These complex cases and some of the older kids that we work with do take a lot of the caseworkers' time. So, staffing is always an issue when they're being pulled in a lot of directions. But we, have been blessed with many interns in our department. And we have quite a few kids going to in the Seawell program right now. So that is a benefit to us just because they're getting, that additional education and looking at cases from many different aspects. So we're hopeful for the future of the department. I think I'm going to turn things over to Jen O'Neill, who is our deputy administrator.
Okay, good afternoon. My name is Jen O'Neill. I am the deputy administrator. This is a new role for the agency. I've been in this seat for about 6 months. Prior to that, I was a solicitor for the county, but I was assigned to children and youth. So I was their lawyer for 2.5 years before when this position opened up, and I really wanted to play a more active role in the stewardship of the agency. So, Barb, you can go to the next slide. So the managers have talked a little bit, of them have talked a little bit about our staffing challenges. Over the past year, the intake department was a focus of our staffing challenge. And you heard Olivia say that there was a period of time where we needed to overflow some of the investigation work to Kelsey's department and Carla's department, to caseworkers who don't normally perform investigations. So that then created some strain in those departments because they had their regular caseloads and the additional work of investigation. As we hired new staff, staffing intake became the priority, and what we've learned from that is the benefit of having all of our new staff start out in intake. The protocol here is that after a new caseworker is here for a year, if a position opens up in another department, they can bid into that. And so what we will see now in the next year or two is that we may have some folks from intake who we hired this year decide to bid into other positions and then bring that investigative expertise and experience into that work. And it is very beneficial for workers in all areas of our agency to be able to see what the beginning of a case looks like. So in Carla's department, when we're preparing for an adoption, the adoption worker who may have had the case for the last 6 months of its time here has to speak to the entire history of the case. And so to have an understanding of what the beginning of a case looks like is valuable no matter what department we're in. We are definitely still hiring. As we sit here today, we have, I think 33 caseworker vacancies. So about 25 to 30% of our staff is vacant at the moment. Barb, you can switch to the next slide. We're very focused on recruitment and retention strategies. The state asks us very specific questions about our efforts in recruitment and retention as we do our budgeting every year. We meet with our staff. We have what we call R&R, recruitment and retention meetings on a monthly basis. Anybody on the staff can come to those meetings and talk about their ideas for how to bring people in and also how to keep people. And those ideas run the gamut. So it can be as simple as, could we make sure that the internet is working here in the office, because the constant internet outage is a frustration that our folks don't need. All the way up to, can we get a facility dog to not just work with the children and be here available on court days, but also, as a morale boost for our staff. There are some other dogs in this building. Some other department, JPO's got a dog. The Children's Alliance Center has a dog. So we are, looking at that and seeing if that's a possibility. We're looking at new ways of training to help with retention. We're developing, or we have 2 tiers of caseworkers, caseworker 1, caseworker 2, that generally has to do with time. And then we're developing a caseworker 3 position, which is a merit-based promotion that caseworker 2s can apply for. So we're hoping that will help alleviate some of the plateauing that happens with our caseworkers who don't want to become supervisors, that there is an opportunity for advancement. We're very active in the speaking engagements and college and career fairs. Our boss just sat yesterday at the Career Link event at the, I think it was the First Energy Stadium, for several hours yesterday afternoon. So we certainly expect to see an uptick in applications from that. As the managers mentioned, we do have a robust complement of interns. That tends to be our best source of new caseworkers. And it's wonderful because they know what they're getting into. And the intern experience allows them to really see what the work is. So that increases the probability that they'll stick around. I think this is actually the last slide. So I guess it's my job to ask for questions now. Dave?
Okay. Thank you, Jen. We will get started. I have several. We're going to reopen up the chat function to allow people to submit their questions. I'm going to ask Molly if she'll help me collect those. But I do have a bunch of questions here. And I have to say, as challenging as this meeting was, I can only imagine what it must be like for all of you in the work that you're doing. What are you looking for in terms of the employees that you're trying to seek? Skill,
So,
experience, or whatever.
so we require a bachelor's degree. Social work obviously is preferred, but we are looking at almost any majors, criminal justice majors. There's a niche here for a criminal justice mind, especially in intake, as the investigative process, puts them in contact with law enforcement and things like that. So, psychology majors, really, Barb, I don't know if does everybody else have the ability to unmute? Okay, good. If you want to add on to that.
So we do find that there's a good pairing with criminal justice majors in our intake departments, just because of the work that we're doing with law enforcement and the courts and schools and the healthcare community, that whole investigative piece. They tend to do well in intake. For our ongoing units, our in-home and permanency units, we find that there's often a good fit with psychology majors, counseling majors, social work majors, that, they're more into the helping profession. And those relationships tend to be much longer than the 60-day at the front door of intake. We're also looking for people who have grit and determination. It's a challenging job, and we're asking individuals to go into homes and to be exposed to some, dysfunctional family situations, to some very challenging kinds of behaviors. And so we need people that are motivated, that have a good attitude. We can teach them the rest. We can teach them the skills and knowledge that they need. One of the commissioners said to me a long time ago, M&A beats S&K any day, and that stands for motivation and attitude beats skills and knowledge. If you come here with a good attitude and you're motivated, you can be successful. So that's what we're looking for.
Okay. Obviously, in many ways, I think of you as sort of being a conduit, getting kids to the services that they need. Who are your community partners? Who do you work with in the community? What organizations, what entities do you work with?
We are working with law enforcement. We're working with hospitals and the medical community. We're working with schools. A lot of our reports come from the school community. We're working with private agencies that we contract with and fund. We're working with other organizations that are out in the community through CCBH, for example, that are funded differently, perhaps through medical assistance. We kind of cover the gamut of everything child welfare, public and private. So we have good relationships. I think we have over 60 contracts with our placement provider community throughout the state of Pennsylvania. And I'm not sure how many. Kelsey, do you know how many in-home contracted providers we have? Something makes me think it's about the same number. But I'm not 100% sure. But we're very diverse in who we work with.
Yeah, I'm not quite sure the exact number, but we work with anyone who needs services, mental health providers, doctors, urgent cares, dentists. I mean, we work with a number of people within our community. Anyone really that the family is working with. But I believe Barb's correct with the number of our contracted agencies.
So you're looking for partners all the time, I presume.
We are. If there's a new service, for example, recently we learned of a service called Crisis Rapid Response. It's very similar to a family group decision-making conference, but it's done within the first 72 hours. whenever we can have a child reside in their home with their birth family, that is the best possible option. So we just created a relationship with 2 agencies that can provide us with crisis rapid response, so that if a child or a family comes to us on an emergency basis, we can engage this provider to pull everybody together to sit down and talk about, you know, what are the risks and how do we ensure that this child can be reunified with the family in a way that's safe. There are going to be bottom lines, right? It's not just everybody comes to the meeting. We do have a voice in what that bottom line is in terms of ensuring the safety of that child. But that's a recent provider, a recent arrangement that we've made with 2 agencies to try to work on behalf of children and families and to stay true to our mission, which is, you know, preserving a family whenever possible.
You mentioned at the very beginning, Barb, that the volume of cases, volume of children that you're dealing with has doubled over the last 5 years. What impact has that had on your organization? What impact has it had on your budget?
Well, I think what we see from our 23-24 budget, which is about 45 million, to our current year budget is 52 million. So we've gone up about $7 million. Our request originally for the next year was to go 3 million more. It's always hard to project what the need is going to be. And certainly when there's turnover in our staff, you know, bringing in new people is great. And we've brought in some really wonderful people recently. We've had some good interviews recently, but they're really starting at the ground up. And so investing in staff training is important. It was on Jen's slide, the Accenture virtual training format that we are hopefully going to be starting fairly soon, where we can, you know, help our new hires, especially these young folks coming out of college. You know, they love PlayStation and Wii's and Nintendos and all that kind of stuff. There are real life simulations of situations that our workers can walk into where they'll get to practice it without being right out in the field. So they'll get to experience some of the work that we do and make decisions about, you know, how best to proceed in working with families. And so I wanted to highlight, you know, the turnover piece of the work that happens here causes us to think about staff training and orientation in some very different ways.
Couple questions about some of the things that are happening. You mentioned transportation being a challenge, being an issue. I know that in my conversations, we did a forum with the Reading School District, and they had a number of kids who didn't have stable home lives. They didn't have places to live, actually. Can you talk a little bit more about those 2 impacts and on what you're seeing in terms of the community and the need for services for children?
Sure. I think in terms of the school perspective, there are 2 laws, both of them federal laws. One is McKinney-Vento for children who are considered homeless, who may be living with their family, but their family is now living with grandma in another school district. So we have those situations. And then we also have situations involving the federal mandate of the Every Student Succeeds Act, or ESSA for short. And that is a child who may have lived in a school district. Now they enter foster care and they're living in another school district. The similarity between both of those laws, while one situation is involving a child who's living with their family and the other involves a child who has been removed from their family, is that we all have collectively a responsibility to do what we can to keep that one element of the child's life the same, and that would be their school. So whenever possible, we are working together with the schools to try to make arrangements for transportation to get children from one school to another. Now we look at certain variables, especially for kids in out-of-home care. If we have a 5-year-old who was attending kindergarten in the Reading School District, and they're now placed in a foster home in York, hypothetically, it may not be in their best interest to drive them 1.5 hours from York to the Reading School District. And so we're going to make a best interest determination there to say it's probably better if this child's going to remain in out-of-home care that they are enrolled in the home school district where they now live.
Mhm.
So we try to look at those situations and work with the schools. The schools do have primary responsibility for transporting children who are living in their own families, the McKinney-Vento situations. But we do try to look at, where we can work together with schools around ensuring kids have transportation. Education is critically important. I think that one of our advisors is on this call. Her name is Melissa D'Amato, and she's also a member of our advisory board. She is a great go-to person that we rely on, as well as schools rely on when we have situations that are somewhat complicated or we're unsure, how to move forward, that we can talk through these situations and develop a plan. And so I don't know, Melissa, if you want to say anything more, but from a school perspective, transportation is a primary need. Transportation is also a need just in terms of getting kids to services and parents to services. We are looking at the possibility of working with Uber Health to see if they can support our work getting parents to their services, whether that's to mental health treatment, drug and alcohol treatment, visitation, medical appointments for themselves or their child. So we're trying to look at creative avenues. We advanced this issue at our public hearing, and we did have a provider come forward saying, we'd like to think about this and develop that idea further with you. So we're working at it from a couple different angles.
Melissa, anything
Did
to
I
add?
answer your question, Dave?
Yeah, I think so. But
Okay.
Melissa, do you have anything you want to add?
Honestly, I think Barb really covered all of it for the most part, but I got to hand it to both our school districts and the Children and Youth Agency. They work very well together. Our school districts work nonstop to keep these kids in school so that their education is not interrupted regardless of their living situation. And when these children are placed in the foster care system, they work very closely with Barb's agency to make sure that transportation is set up and the services are provided that's needed. And our office is always more than happy to step in when there are complications, and we like to be able to be that conduit to make sure the conversation continues between the agencies and the school districts and the community and the families. But otherwise, I think everyone is doing everything they possibly can to keep things going in the right direction for these kids.
Great, thank you. Molly, you've collected a couple questions. You want to go ahead and raise those?
Sure, I have one from Kristen Good. She said, my question is related to dental neglect. In the school, we see most of the times that they are being unfounded, and then the following year, we see that same student and they have the same issues and nothing was done, and another report needs to be made. How do we help the families get their students to the dentist so the following year they don't have the same issues?
Barb, you want to try to answer?
I can, without knowing about particular situations. I will say that we had Dr. Kimball, who I think was on the call or may still be on the call, do a presentation to our staff. Might have been the end of last year about dental neglect and the consequences of the failure to receive adequate care. I will tell you that I know that there has been situations where children are removed as a result of severe dental neglect and have been placed in out-of-home care. Beyond that, I'm not really aware of any particular services. I would encourage you to make a report, particularly if you are a mandated reporter, if you see that there is an ongoing situation that's not being resolved. You know, the reality is we may get a report and it may just not rise to the level where it can be indicated. Or it might be indicated and there's action happening that you may not be aware of. Olivia, is there anything that you can think of that I'm missing here?
Hold on, I'm working on unmuting Olivia.
Unmuting her.
And I have
I know
another question to come
the
back
dental
to
care
if time
is
to.
a significant issue, and I don't think people quite appreciate how significant and challenging it can be for kids.
Right.
Almost got her done.
Yeah. I've asked you to unmute, Olivia.
Her camera looks like it's frozen.
Yeah,
no.
she looks frozen to me.
Let's keep moving with other questions. We'll come back to
Okay, I
it.
have one more new question. This is from Kathleen Palm, Center for Children's Justice. Can they reflect on the growing sense of angst about hidden foster care? Can you ask what is driving the increase in overall number of children and families coming to the agency's attention? Are there 2 to 3 main drivers? So if one of you knows someone else who should answer this question, let me know if I need to unmute someone else.
Barb, you want to try?
Could you read it again? I was
Yep,
trying to see
one.
if I could unmute Olivia. I apologize.
Can they reflect on the growing sense of angst about hidden foster care? And then secondly, can you ask what is driving this increase in overall number of children and families coming to the agency's attention? Are there 2 to 3 main drivers?
It's hard to know if there are main drivers or not. I know that many individuals who are mandated reporters take the role of being a mandated reporter very seriously. And we do kind of reinforce that. If you're not sure, make a report. We can determine here if it rises to the level whether we should be opening it for an investigation or not. The hidden foster care question, I'm not sure about. What I will say is that when back in 2008, we had about 850 children in out-of-home care. We are now averaging for the last year and a half, we're averaging about 250 children in out-of-home care every month. There is a significant decrease. I think some of that has to do with utilizing programs that are evidence-based. You know, one of the parenting programs that we provide is called Nurturing Parenting. That's an evidence-based program. We've also placed more emphasis on ensuring that we're making every reasonable effort. The law requires that we make reasonable efforts before children are removed. We have a team of individuals here that consists of at least 2 managers and 1 attorney before we even go into court, that we're staffing cases to determine, did we try everything? So the use of evidence-based programming, like nurturing parenting, like visit coaching, like family group decision-making, I think has helped us to reduce the number of children who are entering out of home care, as well as family finding, you know, really looking to engage families. And we talked about family finding, and we talk about it in terms of finding aunts, uncles, grandparents, but we have placed, you know, we have found school teachers who are supports to children, Girl Scout leaders, track coaches. You know, there's a number of individuals that love and care about kids outside of the birth family. And we have individuals on this call who have fostered and have adopted, and who have a big heart for children. And so we're looking for kinship in terms of a biological relationship, but we're also looking for fictive kin and those individuals who love and care for a child, and they may not be biologically related.
Molly, do we have any other questions?
No, we don't. I think Cindy has a closing comment.
That's where we're gonna go next. Cindy. Hopefully we can unmute you.
There we
Oh.
go. Well, I just want to say thank you, everyone, for joining us today. Thank you to all the presenters. And I just want to say to all of our Child Protective Service workers and all the providers that work with our families, we see you, we appreciate you, and we thank you. Thank you for all the hard work you do. It is a hard job to do. And we as a community, we can never thank you enough for all that you do. So thank you.
And thank you,
Thank you
Cindy.
for having us.
Yeah, thank you for raising this as a topic. I want to thank Barb and the team, Olivia, Kelsey, Carla, Jen. This is just inspirational. And the challenges that you're dealing with, hopefully you can make it through a lot of them. We're living, as I said at the very beginning, we're challenging times. And it doesn't look like the challenges are going to be over in the foreseeable future. But you're doing terrific work and so important. It's so important to give these kids a chance to succeed in life, and that's what you're doing. And that's just terrific. I want to thank everyone for joining us today. We will send out the video to everybody. If you're okay, Barb, we'll also send them the PowerPoint presentation, so they'll have that. It's just terrific. Thank you all. Cindy, once again, thank you for raising this as a topic. And we will see everybody hopefully at our next session, where we're going to be looking at the new facilities and operations at the Oak Brook Housing Development, a new community center that is transforming that area as well. So thank you all. Hope you'll have a good rest of your day and an enjoyable weekend and good holiday season coming up.